Step into office hours with California's doctor, where health meets real talk. Hosted by the California Surgeon General, these conversations will tackle health issues that truly impact everyday life, from mental health struggles to game-changing medical innovations in public health. We will dive deep into the topics that matter most to Californians and their community. Informative, empowering, and thought-provoking. Whether a health professional, advocate, or simply curious about improving well-being, these conversations are a trusted source for insight and guidance. Your health is the foundation for a healthier future. Let's build it together. On this episode of Office Hours with the California Surgeon General, Dr. Diana E. Ramos sits down with Dr. Afshan Hameed to discuss the intersection of cardiovascular health and maternal health.
We are here today with Dr. Afshan Hameed. Dr. Hameed is truly a brilliant physician. I have known her my entire career, and I had the privilege and honor of meeting Dr. Hameed when I was a resident and she was a fellow. We were both training at LA County USC at the time. Dr. Hameed is a maternal-fetal medicine specialist and a cardiologist at the University of California, Irvine. She is really an expert in many areas. She's co-authored interconception care guidelines from ACOG in women in hypertension, forming lots of the algorithm, has been a key partner with the California Maternal Quality Care Collaborative. Dr. Hameed is truly not only a spectacular physician, but a very kind and wonderful person. So it gives me great pleasure to be here with Dr. Hameed to talk about cardiovascular disease in women's health. And if anybody has the expertise and the knowledge, it truly is Dr. Hameed. So with that, we'll start with our first question, Dr. Hameed. And please tell us, what should every person know about cardiovascular disease overall, for men and for women?
Thank you so much, Dr. Ramos. I cannot thank you enough for providing me the opportunity and for being here today. You're very kind. Thank you. So in terms of cardiovascular disease in general, whether it's men or women, we know that cardiovascular disease is the #1 cause of sickness, hospitalizations, even mortality in both men and women. So I think it's up there, and there's a lot of initiatives that are going on, helping understand and more so educate men and women throughout to look out for those cardiovascular risk factors.
So generally, we think of heart disease, cardiovascular disease, as being a men's disease, but I'm sure some of your research has shown, and in caring for women throughout their life course, this is not a reality. Can you share a little bit more how heart disease could manifest in women compared to the traditional thought of when we think of heart disease and we think about it in men primarily?
Absolutely. I think that's one of the misconceptions. In general, you would think that cardiovascular disease just affects men. But we know that women, as they age, as we know, estrogen is protective. So relatively, during the reproductive years, women are protected. But then later on in life, women are at the same or even higher risk than women as they grow older. And that brings another point I wanted to emphasize. As I say, the reproductive age women, at the same time, we know that cardiovascular disease is the #1 cause of maternal mortality in young people who were pregnant or in the postpartum period. So it's all over the women's lifespan. It's not just the older women, but there are some younger women that may be at risk as well.
Thank you for bringing up the reproductive time frame and pregnancy, because your work is critical in addressing the #1 cause of pregnancy-related associated death in California. For all ethnicities in California, cardiovascular disease is the most common cause of death. And this truly is a call to action because many people, men and women, are not aware of that. And we think of heart disease of something that happens when you're older. Why is it that heart disease is really a risk factor in reproductive and the most common cause of pregnancy associated deaths for women in California? Are there any genetic predispositions, or is it lifestyle? What is it that is setting us up for that risk?
You bring up a great question, Dr. Ramos. I think when I look at when we reviewed maternal mortality, there were two big um, um, opportunities or quality improvement opportunities that came up. One, that about 2/3 of the women who died of cardiovascular disease did not know that they had symptoms. They had presented to the hospital, for example, with shortness of breath or with fatigue or swelling, but they didn't know when to seek medical care. And more disturbing to us was the fact that about 70% of the healthcare providers, even though a young patient was coming in, whether pregnant or in the postpartum period, with those symptoms that would otherwise be cardiac, for example, shortness of breath, fatigue, edema, and stuff, they didn't think that it was cardiac either. So the biggest gap that we have is really understanding the fact that if anybody presents with a cardiac symptom, they need to be evaluated in general. When it comes to reproductive age or pregnant patients, I always say that there are two types of cardiovascular disease, two ways that they get diagnosed. Patients who have pre-existing cardiovascular disease, these are patients with congenital heart disease. They know that they have heart disease. They go to the appropriate level of care. They get to their appointments. They are not the ones that actually get sick in the sense that we are able to prevent them from getting hospitalized or getting sicker or prevent them from that extreme consequence of as maternal mortality. But then there's a big piece, whereas women who don't know that they have cardiovascular disease, it could be that this patient has some small or insignificant cardiovascular disease that becomes more prominent, that becomes manifest when they get pregnant. Because pregnancy, as I always say, is like being on the treadmill for 9 months. So your cardiovascular system is overworked, and they come in with symptoms of, for example, shortness of breath or chest pain or not feeling well. So that is another component. The third piece actually is the peripartum cardiomyopathy, which is weakening of the heart or dilated heart that doesn't work, doesn't pump, just specific to pregnancy. It can happen anytime during pregnancy, but more so towards the end of the pregnancy or up to 5 months postpartum. And that is the big challenge, because as healthcare providers, we think that patient had an uneventful pregnancy. She went home with her baby. And then a month later, if she's returning to her primary care or to the emergency department with shortness of breath or complaints that may be suggestive of cardiomyopathy, they are often not taken into account because we don't think that, again, a young patient can have a cardiac problem. So my message to everyone would be for the patients, if even if you are young, you're pregnant or postpartum or any part of your life, if you're having symptoms that are uncomfortable, that are making you deviate from your usual routine of life, for example, you can't go upstairs, or you're not able to exercise as much, or any of that, please seek medical care. Please know that cardiovascular disease is one of the leading causes of death in pregnancy or in the postpartum period.
That is very insightful, and thank you for that message. Now, we keep on hearing the fact that in California, as well as in nationwide, the pregnancy-associated death in the Black moms, the Black population is 3 to 4 times higher. Are there any differences in terms of risk factors or predisposition with cardiovascular disease, not just in the Black population, but in other ethnicities?
Yeah, that is well known. And Black patients, I think it's multifactorial. There's no one answer that is going to satisfy the question. But in general, Black population has a higher risk of underlying cardiovascular risk factors. And if we think of those, these basically are obesity, hypertension, diabetes. Those are the big ones, high cholesterol and all that. And I think the biggest piece is obesity, because that leads to all of these metabolic derangements and leading to other medical issues. So I think so it's a different risk profile of Black patients. And then you factor in other social determinants of health and and the various type of biases that we experience in the healthcare system. So it's a multifactorial, but I'm so happy that we are paying attention to that and we are bringing it up so that we can bridge those gaps and improve care for Black people.
Thank you. The other risk factor that we're also hearing is advanced maternal age, that women are waiting to get pregnant later on in their life, and that's very different from what we had previously been saying. What is your observation, or how does that correlate with risk factors in terms of cardiovascular disease and overall outcomes in pregnancy and risk factors?
You bring a great point. No matter how we slice and dice data on maternal morbidity and mortality, age is a huge risk factor for many reasons. One, you alluded to, child-rearing age has gone up over years. And as a human being ages, they tend to have more medical issues. So it goes hand in hand. But when we look at the cardiovascular disease-related morbidity and mortality, again, age above 35 and more so above 40 is where we see a significant rise in maternal morbidity or even mortality.
So for those who are listening and they're thinking about becoming pregnant, is there anything folks should be doing to prepare their heart, to prepare their body before pregnancy?
I think the biggest thing that every individual should look at their own overall health. I recommend that that they seek medical care to assess their cardiovascular risk factors, their general health, and especially if somebody has diabetes or high blood pressure or they are obese, it's always a great idea for them to work on all of those before they get pregnant. Because we know that if any of those risk factors are well controlled prior to pregnancy, the pregnancy outcomes are better. There is less chances of having complications during pregnancy and having a healthier mother and the baby. Unfortunately, vast majority of our pregnant or patients, they get pregnant and they seek medical care for the first time when they are pregnant. And the next best is at the first visit when they present to obstetric or healthcare provider for their pregnancy care. That is an opportunity to look at their risk factors, because if you're able to modify, excuse me, and address those, improve the blood pressure control, improve diabetes control, and if they're underlying cardiovascular disease, for example, that may be an opportunity to work on those and improve those for the healthier outcomes. At the end of the day, unless we know that there's a problem, we can't fix it. The only way to know is either the patient, the best way is if the patient feels or they are able to seek care because they are not feeling well. Healthcare cannot help them unless a patient comes to healthcare, right? But having the awareness that shortness of breath that is out of ordinary, or having chest pain, or not able to walk as much as you were doing before, is a red flag. So please seek attention and make sure that you have an answer to your question and you have an appropriate workup and treatment before you go on to be pregnant.
Thank you, Dr. Hameed. Those are fantastic recommendations. Listen to your body, know that there is support and help available, but most importantly, seek the care. And I know sometimes we shy away, we dismiss our health because we're focusing on the health of our children, of our family, but we need to make ourselves a priority as well. So I've learned so much from you over this past few minutes spending time with you, Dr. Hameed. Thank you. I want to end with two questions that I ask all of our podcast participants. The first one is, what does health and well-being mean to you personally?
I think health and well-being is able to do everything that you want to do in life, in terms of the physical activity levels and in terms of the life that you would like to lead. If you have medical issues, very common overall in population, make sure that you pay attention to them and don't put them off. In terms of the women's health, I have a particular interest in that area because I strongly believe that women's education awareness leads to a ripple effect, not only in the family, but in the community. So it's very important to educate and empower our women.
I love it. Thank you for that suggestion and that push to educate and empower women, because we truly have that bigger impact. And then finally, you are quadruple boarded: internal medicine, OBGYN, maternal fetal medicine, cardiology. You are seeing innovation and change, not only in general women's health, but in healthcare overall. What's one innovative idea that you've come across that you can see could be critically important in improving the health in California?
My area of expertise and passion lies in early detection of cardiovascular disease, particularly as it relates to pregnant patients and in the postpartum women. So my professional goal is to make sure that every single pregnant patient gets cardiovascular disease risk assessment and they're made aware of the risk. So down the road, if they develop any symptoms, they are able to seek care and get the care that they need to prevent complications in future. We also know that pregnancy complications, they lead to cardiovascular complications 20 years from pregnancy or even later. So pregnancy is an opportunity. It's a window of opportunity for us to make a difference that will have lasting impact, not only in women, but also their families and community.
I love it. It's a call to action. We're going to be watching you, Dr. Hameed, as you are developing that cardiovascular assessment for everyone who can potentially become pregnant in California and beyond. Thank you so much for sharing your time, your insight on how cardiovascular disease really impacts not just men, but women and beyond. We know that addressing women's health, women's cardiovascular health, really does make an important difference in lifelong health for the mom and for everyone else's life that she touches. Thank you. And again, have an amazing day and appreciate your leadership and your time.
Thank you so much. Thank you.